This is the most common question that I've been receiving from parents, which is when should my child visit an orthodontist? So the American Association of Orthodontists recommends the first visit at age 7. At this assessment, we will check growth and development. Even if the treatment, if it's not needed yet, what I usually explain to parents that not treating now is already a treatment, but we need to assess. We need to see if the patient has all the permanent teeth. We will take an X-ray so we can see if the permanent teeth are all there. If we have the upper and the lower jaw growing as it should. One of the signs that I believe the child may need braces, and I ask parents to have a look as well, is we need to look for crowded teeth or overbite. Overbite is when our upper teeth covers a lot or completely the lower, or underbite when they don't cover at all. Or if they have a difficulty in chewing, these might indicate the need for braces or aligners.
Okay. Last question just on that. So I've got 2 daughters, 8 and 10 years old. I was surprised that you need to be checked so early because it used to be, 12 years old or was, when the adult teeth were through. I think a lot of people would be surprised that it is so young, but I've seen myself the benefits of getting them checked earlier, to have that interception done if necessary, to have, the certain teeth taken out to make an easier pathway. So I think it's a really important point you've made, that it is good to get checked at a younger age than previously would have been the case.
Yeah, like what I usually explain is that this will prevent future complications and even more expensive or more complex treatment afterwards. So, for example, if the patient has a crowded teeth, this means that we don't have space for the teeth in the arch. So we need to make room for the permanent teeth. Worst case scenario is that these permanent teeth, if it doesn't have place to come out, it can stay inside the bone, which in the future will lead to surgery and complex cases or even extraction. So if we see it when the patient is growing and have this eruption process happening, it's way easier. We can prevent doing some baby teeth extraction or opening give more space in the arch. And then we prevent this complex treatment in the future.
Excellent. So taking advantage of their growth is obviously a really important thing that this helps with.
Yeah. And another myth that usually some patients or some parents believe is that, my child already have a problem. And I believe that once my child grows, this will be like corrected, or I don't need to do anything. But what I like to explain is that if we already have a pattern of growth, let's say the upper jaw is growing more than the lower, or like the lower more than the upper, this will just accentuate in the future. So this is not going to self-correct. This can even get worse. So this is very important for parents to understand that the growth will just, if we have a pattern, we need to change a bit, because it can get worse in the future.
Excellent. Okay, makes a lot of sense.